Good morning. My name is David Campos. I'm a Deputy County Executive with the County of Santa Clara. And you are live with the County of Santa Clara. We're here today across the street from the Emergency Operations Center for the county, where you have dozens of county employees that are working round the clock to make sure that we are responding to this COVID-19 crisis as well as possible to minimize the number of people that are infected and the number of deaths in the county. Today we'll be discussing a very important subject, which is how are we addressing the needs of the homeless population, people that are facing homelessness in the middle of this crisis. Before we do that, I do want to note a couple of things, and I ask people to go to our dashboard, to our website, to look at the latest numbers on where we are with the COVID crisis, and that is at secphd.org/coronavirus. That dashboard tells us that as of April 5th, we have 1,207 cases in the county of Santa Clara, 59 new cases, and a total number of 39 deaths. And of course, our thoughts and our hearts go out to the families of those who have died. We also want people to know that as of April 5th, we have 191 ICU beds that are available in our system. We have 1,438 surge beds that are available in our system, and we have 435 ventilators. So with that, let me now ask one of our first guests, Supervisor Dave Cortese, who has served on the Board of Supervisors for a number of years and has been a leader in the area of housing and dealing with the crisis of homelessness. Supervisor Cortese, what do you want our residents to know about what the county is doing on this very critical issue?
Well, the first thing I'd like people to know is that for the last 5 years, the homeless population has been a huge priority for the county. During that time, we have passed something called Measure A, thanks to you, the voters, which has allowed us to build up our inventory of permanent supportive housing for the homeless, and it's something that we're continuing to do. But it's also allowed us to build up our own Department of Supportive Housing, our Office of Supportive Housing, and to create things like the Valley Health Care Program, Homeless Health Care Program, which is doing a great job right now reaching out to the office and reaching out to the homeless. In fact, both of those departments or offices or divisions are ready in large part, I think, because of the work that's been done over the last 5 years to focus on the homeless population. So that puts us in the position today of as of Friday, having made sure that 174 of the homeless who were tested positive, who were infected, are put into quarantine, that people who continue to be tested positive or exhibit symptoms can be moved out of encampments and into safe places. And it also means that we know where encampments are. We have the human infrastructure, if you will, to go in and screen and test and make sure that the unhoused population, the unsheltered population, which is about 8,000 in this county, gets the same kind of attention and care and resources and treatment and compassion that the rest of the population is getting right now. So it's like everything else with COVID-19 right now, we've got a long ways to go. Nothing is yet perfect. We don't have the vaccines and the inoculations yet that we need, but we're certainly doing everything we can as a county to protect our unhoused population, our unsheltered population particularly, and I'm very proud of that.
Thank you, Supervisor Cortese. And a person that perhaps some may not know who has played a very important role when it comes to the issue of homelessness and housing people in the county is Key Lee with the Office of Supportive Housing. And I've known Key because of his work with Measure A, which, as Supervisor Cortese said, the voters passed. And because of the work of Key and his team, the implementation of that measure is ahead of schedule. So from that perspective, we have the experts, the people who know how to get this done. So Key, what do you want our residents to know about where we are? Because it really is about giving transparency and giving them the numbers.
Yes. Thank you, David. The Office of Supportive Housing has the privilege of coordinating and implementing the county strategies to reduce and prevent homelessness. For example, between 2015 to 2019, we helped over 14,000 men, women, and children who are homeless obtain permanent housing. We were meeting some of the need before, and during this crisis, we're challenged to increase our services to meet a growing demand. And of course, when I say we, I mean the staff at the Office of Supportive Housing, the other county departments, and our key partners from the cities, from the Housing Authority, nonprofit agencies, and Destination Home.
Key, one of the questions that people have asked me is, so we have homeless folks in congregate settings. What are we doing to make sure that the guidelines around social distancing are followed, even in that setting?
Yes. Thank you, David. So when the order to shelter in place first came out, we had approximately 2,000 to 2,100 shelter beds. We could house or temporary shelter 2,000 to 2,100 homeless men, women, and children. In order to meet some of the social distancing requirements, we set a target reduction of about 300 shelter beds, and we have been able to do that and expand shelter bed capacity, which I'll speak more to later. But definitely we are meeting social distancing requirements. We also had all of our shelters go 24/7, and all of the seasonal shelters extend their duration.
Thank you. Now, a very important program that we have here, and Supervisor Cortese talked about Valley Homeless Healthcare Program, and we have Livia Echeverria who's here to talk about that. Can you talk about what the program does and some of the outreach efforts that you have engaged in?
Absolutely. So the Valley Homeless Healthcare Program in normal life provides comprehensive medical services to people who are homeless, and that includes primary care and behavioral health services. However, in the face of coronavirus, we have created an entirely new medical delivery system. We have closed most of our clinics, and we've redeployed our staff to address this epidemic. One of the things that we have done from the very beginning of this is do outreach to the encampments, and that's in partnership with the Office of Supportive Housing and the city and our community partners, all of which who have outreach teams. We went and we've provided a lot of education to our encampments about the virus itself, about what they can do to protect themselves. We provided hand sanitizers to them, we coached them on social distancing, and coached them on how to receive medical care if they were experiencing symptoms or saw somebody else who was experiencing symptoms.
Can you talk a little bit about how we're expanding capacity in our system as we're looking, to the days ahead?
Sure. As of Sunday, we have added approximately 602 spaces, temporary shelter spaces for homeless individuals and families. These 602 spaces include congregate shelter settings like the Gateway Pavilion at the fairgrounds, Parkside Hall at the city of San Jose. It includes also hotels and motels. And as I mentioned earlier, this 602 beds, half of it made up for the capacity that we lost in order to meet social distancing requirements, but we do have a net of over 300 shelter beds so far, and we're working to expand both congregate and non-congregate shelter sites in the coming days.
So we, on an ongoing basis, will be giving you more detailed information, not only about the issue of homelessness, but other issues as part of the daily briefing, and we will maintain you updated on what's happening with homelessness because the numbers change, but we're going to continue to work. I'll turn it over to Supervisor Cortese to have the last word here on this issue of homelessness, but on the COVID-19 response from this county. Anything else that you want the constituents of Santa Clara County to know from you, Supervisor?
Well, first of all, I think what we all want to do is thank the constituents, the residents of Santa Clara County, housed or unhoused, for their cooperation. There's 2 million people in this county who are doing a great job of supporting the public health officials' guidelines and supporting all of us in our work. And I would just close by saying that the Board of Supervisors, all 5 of us who represent the 2 million people in this county, remain completely committed to funding and appropriating the resources that are needed to address the homeless population right now under these circumstances. So as Mr. Campos said, you'll hear more, you'll see changes in the numbers, and you'll become aware of more things that we're doing in the future because of the commitment of this county to make sure that the unhoused are taken care of, just like everyone else, during this COVID-19 crisis.
Thank you, and see you tomorrow for our next briefing.